Trump's tariff may starve America of medicines. Crisis looms over India's generic drug supply. You might be surprised to hear that in the coming months, even a powerful and developed nation like the United States could face a shortage of essential medicines. Hospital treatments may become more expensive, illnesses could last longer, and the financial burden on ordinary citizens may increase drastically. At the root of this looming crisis is a recent decision by US President Donald Trump, a decision to impose heavy tariffs on imports from India. But was Trump's move aimed solely at hurting India? Or could it end up harming American citizens even more? That's the focus of today's story, a deep dive into the complex web of India-US trade relations, the pharmaceutical industry, and the real impact of political decisions. But before we begin, if you are new to our channel, don't forget to subscribe so you always stay updated with our latest videos. Let's begin today's discussion without any delay. As of 9th April 2025, the 26% reciprocal tariff announced by Donald Trump has been temporarily suspended for 90 days. However, this is merely a temporary relief, not a permanent solution. Trump imposed this tariff on goods exported from India to the US under the pretext of seeking fair and balanced trade with every country. But the reality behind this move tells a different story. It's the US that gains significantly from its trade with India, especially in the pharmaceutical sector. India is known as the pharmacy of the world, and that's not just a title, it's a global truth. Millions across the globe rely on India's affordable, reliable, and effective generic medicines. The US is no exception. In the fiscal year 2024, India exported around $8.7 billion worth of pharmaceuticals to the United States, accounting for roughly 31% of India's total pharma exports. This means a significant portion of India's pharmaceutical industry's revenue comes from the American market. But there's another crucial aspect to this relationship: America's dependence. Nearly 47% of the generic medicines used in the US come from India. This means that patients, doctors, and hospitals across the US are heavily reliant on Indian pharmaceuticals. According to a report, these Indian medicines helped the US healthcare system save nearly $408 billion in 2022. These numbers make it clear: the India-US pharma trade is no longer just a profitable deal, it has become a necessity. If Trump's tariffs are implemented, the first and most direct impact will be felt by American citizens. Medicines will become costlier. The poor and middle class may start avoiding treatment. Pressure on health insurance companies will increase, and hospital expenses will surge. This entire cycle could destabilize the US healthcare system. And that raises a serious question: is Trump's policy a political stunt, or is it a sign of short-sightedness? India's pharmaceutical companies have responded swiftly and clearly to this decision. They've stated that if the tariffs are implemented, the burden may be passed directly onto consumers. In other words, Americans may have to pay significantly higher prices for the same medicines. 𝐮𝐩𝐿𝐴, MD of Sun Pharma, mentioned that they currently sell medicines in the US at rates between $1 to $5 per bottle. If a 10% to 25% tariff is imposed, it will directly impact production costs and pricing. In such a situation, the US will have to reconsider: can it really replace Indian generic drugs with alternatives from China or any other country? The answer is highly unlikely. India's unmatched capabilities in generic drug manufacturing, quality control, and the global distribution network make it incredibly hard to substitute. India brings experience, scalability, and cost-efficient production, a combination few, if any, other countries can offer. Trump's policy, while posing a challenge to Indian pharma companies, is also giving them a fresh opportunity to reaffirm their value in the US market. Of course, there are hurdles: rising raw material costs, complex logistics, and stricter US regulations. But India's pharmaceutical industry has overcome these before, and there's strong optimism that it will do so again. Meanwhile, 𝐮𝐩𝐿𝐴𝐻, Secretary General of the Indian Pharmaceutical Alliance, stated that this issue can and should be resolved through mutual dialogue. He expressed hope that India and the US would continue engaging in constructive discussions and that a concrete resolution would emerge, because this is not just a matter between two nations, it's about the lives of millions who rely on these affordable generic medicines for treatment. The real question is, if the US stands to lose from this decision, then why did Trump impose the tariff in the first place? Is it part of an election strategy or an attempt to pressure China, with India becoming collateral damage? It's possible that in trying to reduce America's trade deficit with China, Trump is weighing India on the same scale. But the fact remains, India's role is very different from China's. India is not just a trading partner, it is a trusted ally and a dependable supplier. On the other hand, even within the US, healthcare lobbies and pharma industry stakeholders are deeply concerned about the tariff. They know that if India's supply chain is disrupted, it will lead not only to a rise in drug prices, but to a broader crisis. It could trigger shortages, a surge in black market activities, and an influx of counterfeit drugs, putting public health at serious risk. The Indian government has also become actively involved in the matter. High-level meetings are currently underway between the Ministry of External Affairs, Ministry of Commerce, and Ministry of Pharmaceuticals to diplomatically resolve the issue through discussions with the US. India aims to clearly convey that a unilateral tariff is not only unfair, but also untenable. Looking at the history of India-US pharma trade, it has always been mutually beneficial. India earned in dollars, while the US gained access to affordable and reliable medications. If a tariff barrier is erected now, both sides will suffer, but the US will suffer more because India has other global markets eager to purchase its medicines. This entire episode also highlights a crucial reality: how fragile global supply chains can be and how a single political decision can impact millions of lives. In the coming weeks, it will be interesting to see whether Trump stands firm on his decision or yields to international pressure and public health concerns. For now, a 90-day reprieve has been granted, but this window is going to be crucial for both India and the United States. If the issue is resolved through dialogue, it could strengthen bilateral ties. But if not, the world may witness the emergence of a global pharma crisis, and the US will bear the heaviest burden. India must use this time wisely to strengthen both its domestic strategy and global outreach. Under the vision of Atmanirbhar Bharat, self-reliant India, the country should look beyond the US and actively expand its pharma network into Europe, Africa, and Latin America, ensuring broader market access and global health leadership. In the end, it must be said, politicizing medicine is not just dangerous, it's unethical. This isn't just about trade, it's about human lives. Whatever Trump's tariff policy may be, he must not forget that a true leader is known for his foresight, and true foresight is not driven by profit, but by understanding human need. Will Trump realize that generic medicines are not just cheap alternatives, but a lifeline for millions? Or will humanity once again be sacrificed at the altar of politics? That answer will define not just policy, but principle.
If our video has taught you something new, do not forget to like and share this video so that this information can reach others as well. Your likes and shares are a source of inspiration for us. If you have any questions or suggestions, please let us know in the comments. It will be our honor to answer your questions and listen to suggestions. And yes, if you like our content, subscribe to the channel and press the bell icon so that you stay connected with every new story. Thank you. GRT Business YouTube channel sources: news from various news agencies, opinion polls, and other public sources. We try to ensure that every report and summary is accurate and verified, but we are not responsible for any dispute or error. Our aim is only to provide you with accurate information.